Okay, well, good morning, everyone. Thank you for making time to be here on our weekly SEDP update call. Have a few special guest speakers today, but we really want to focus on what's going on right now in regards to vaccine distribution. It is definitely one of the top two questions that we have been getting from businesses in Shiawassee County over the last few weeks. The other is access to capital and grants and things like that. We're going to talk about that later in the call. So our two leading organizations that are helping with this, Memorial Healthcare and the Shiawassee County Health Department, have graciously joined our call today to give you all an update on where things stand in regards to vaccine distribution. And we want to just make sure we keep you in the loop. So you've probably seen from some of our emails and social media posts, as soon as we get that information from Memorial and from the health department, we're sharing it with you because we know it is top of mind. So for this call, though, I'd like to jump right in. I'd like to give both Tom Kurtz from Memorial Healthcare and Larry Johnson from the health department an opportunity to give an update from each of their respective organizations. So we'll start, Tom, with you first from Memorial Healthcare. Go ahead.
All right. Can you hear me this morning, Justin?
Yep, you're good, Tom.
All right, great. First off, I'd like to say thank you to the community for being extraordinarily patient as we get through this vaccination process. It's been challenging from an administration perspective when we have a specific number of people out there that would like to receive the vaccine, but we only have a limited quantity. So right now we actually have our web form available. We're taking 1,000 patient requests. We do not have 1,000 doses to give right now, but because of the relatively inconsistent shipping notifications and deliveries from that we will be receiving from vaccines, we're going to be taking 1,000 requests at a time and working through those requests as we can. So right now our web form is open. We're taking the next 1,000 requests and then capping the survey. And then as we have doses to give, we will give those out. So if you go to memorialhealthcare.org, click on the red banner at the top that says COVID vaccine information, you can enter the form there. We opened it up 6 minutes ago and we already have 300 responses. So I have a feeling that 1,000 number is going to be used quite quickly. And again, the rationale behind us using that method to gather 1,000 at a time is that we can start working those lists as we get doses in, and then we can continue to work through them as we have availability. As many of you already know, we are in phase 1B of the vaccine administration, which includes all of phase 1A, which is direct healthcare workers, plus anyone over the age of 65, school teachers, essential workers, and those types of things. So on our website, you can also see who qualifies under phase 1B at the moment. So again, that opened at 9 o'clock this morning. We'll take the first 1,000 responses and we'll work through those as we have vaccine availability. If we get 1,000 vaccines in, we'll schedule everyone on that list and start another list. So that's how we've decided to continue with this. And it's purely because we can't predict what first doses we will be shipped. The state of Michigan has outlined that we can no longer each week put in requests for doses. We will get them allocated to us by a population basis. So we really have no way of knowing until they arrive what doses we will be getting. So that's kind of where we are right now with the vaccine administration. I will tell you that we have administered, I'm going to use rough numbers, we've administered roughly 2,800 doses. That's a mix of first and second. We've done 2,250 first doses, 550 second doses, and we continue to work through that process. Many of which have been direct healthcare workers. That would include Memorial Healthcare staff, but also our independent medical community, our independent practices, dental offices, optometrists, and so forth. We've also been very lucky to be able to do 1,300 community members. Last week, we did a community vaccine clinic of 1,100, a little bit over 1,100. So we've been lucky enough to do 1,300 first doses for community members. Right now, we have no vaccine availability. As it comes in, we will schedule patients, but we don't have first dose availability remaining. We do have this week several second dose clinics scheduled throughout the next 2 weeks, actually. We have a lot of second dose clinics scheduled, and we do have those on hand to deliver. So we will be doing second doses Wednesday and Friday of this week, and then all of next week we'll have second dose vaccination scheduled. So as I mentioned, we've done roughly 2,800 doses. They don't, when we get deliveries, they don't necessarily sit on a shelf. We schedule them as quickly as possible. Our goal is to have all of the vaccines distributed within 7 days of receipt. So when we get them on hand, we distribute them as quickly as we can. So again, that form is open on our website, memorialhealthcare.org. I don't believe that this will last the hour to hit that 1,000 requests. And so as we have vaccines available, we'll start working that list. And as we have additional vaccine available, we'll reopen the list on a periodic basis. I'm happy to entertain any questions that might come up. I think you might do those after Larry's presentation, but so that's where we are from Memorial Healthcare's perspective.
Sorry, had to unmute myself. Tom, thank you. I do have a quick question here. This has been, this is maybe a technical question, but before we jump to Larry. So obviously these require 2 doses. You're getting first-time people in the door for a dose. Do you reserve second doses for those people, or how does that work?
Yeah, so when we are delivered a first dose, the state gives us a shipment of second doses that are, I'm using air quotes, guaranteed. So when we get a shipment today, that means 3 weeks from now, we'll get another shipment of the same quantity. So we don't have to split them. The state is doing that split for us. So we get the first doses, and then 3 weeks later, we get the second dose shipment.
Gotcha. Okay. I was just curious. I had a few people ask me about that. Great update. Thank you, Tom. Larry Johnson from the Health Department. Do you want to jump on and tell us what's going on from your office, please?
Yes. Can you hear me, Justin?
Yep, you're good, Larry. Go ahead.
Excellent. All right. Well, thank you very much, everyone, for having me. It's great to be back. I've been with you quite a few times over the last year, and I think I'm going to be with you for a few more times. I'm going to get into the vaccines in just a moment here to kind of follow up to what Tom was talking about, but I want to give some good news first on where we're trending right now with our numbers. Over the last 5 weeks or so, our new case numbers week over week have been on a downward trend. So that's good. That's a real positive that we're monitoring. Our case positivity rate has been also on a downward trend. Right now it's at 8.3%, for a little bit higher than the state average, which is around 6%. And then our Lansing region's around 7%, but all have been trending downward. Our active cases have also been trending downward. We're less than 500 this week, and that's down from when we were up around 1,500 to 2,000 actives. So seeing some real positive numbers. We didn't see the great spikes from the holiday. There might have been some little upticks here and there, but and then, as you know, the opening of some parts of the economy are coming here on February 1st. The big one, obviously, the restaurants. I don't even want to get into that right now because that's a whole other discussion. But for today, we wanted to just talk about the vaccines. And I guess I just want to start by saying that this has been really tough because the demand is really, really high for this vaccine. and quite frankly, there just isn't enough supply. We have a strong infrastructure that's ready to go. We have capacity to get the vaccine out. We are working with Memorial Healthcare. We are also working with local pharmacies, and they're just not sending us enough. And it's really hard. But our focus has been the frontliners, like Tom had talked about: healthcare, EMS, emergency responders, the police, the fire, school personnel. Is one of the ones that we're working on right now. And these are all phase 1B, 1A and 1B. The big demand that we're seeing is from the 65 plus crowd or age group. And so what we've done, our systems have been overwhelmed with people calling in and emailing. In fact, it took our phone lines down one day last week, but we have a list that we're keeping track of. It's probably well over 3,000 individuals right now. Over 65, because that's what we're going to focus on here once we're done with these frontliners. And at the rate we're getting vaccine, we're just not going to be able to get to them quickly. And just to give you an idea of what we've received so far, we've received 1,100 first dose vaccine, the Moderna, and we have either allocated it or given it to all 1,100. We will be through 1,100 by Friday. So regarding second dose, we've received 400 second dose. And as Tom said, that's guaranteed for those people that got the first dose. And we've already started on our second doses, getting those out. We're running clinics this week for that. Tom mentioned a formula that the state developed. So previously we had been ordering vaccine, and then they would send it to us. So but the first week I ordered 3,000 doses. They sent me 400. Last week I ordered 1,000 doses, and they sent me 300. So it's like, how can we be going backwards here on this formula? It's outrageous. So I've made a lot of calls, been a lot of interaction with legislators, the governor's office. I've worked with Gary. I think he might be on the line. And I don't know. I think they're limited in what they can do. But something's got to change here, because we will be vaccinating for the next 10 years at this rate, and that is not acceptable. So I don't know that any of you can do anything other than to hold tight, because many of you have inquired. You did the survey here earlier this month, and you're like, and we thought, okay, that's great, let's get ready to go. Well, it's not going to be anytime soon for your businesses. And so we have to prioritize. We've got to tackle these emergency responders and these 65 and up, and then we've got to get into the essential critical infrastructure too. Once we're through the 65 and up, we will be communicating probably through Justin and directly through your businesses, because we have all your emails and contact info, and we have the numbers that you submitted to us. We will be running clinics for those groups, for your businesses. Some may be on site at your facility if it's big enough. Some may be at the health department. We are working with Owasso schools because of their facility up there at the high school is very large and very user-friendly for the public to do vaccination clinics. So we're working with them. I would have been able to do all school personnel in one day had we had the vaccine that I ordered. And I was going to order 50,000 doses this week just to see what they would say, but now they're telling me I can't even order it anymore. And it's some just complicated population-based formula that I haven't even figured out. I haven't even seen it in writing yet. So I could sit here and whine all day, but that's going to make more vaccines show up. But I just want to let you know that we are keeping track. If you call our hotline, which I shared our website with Justin just earlier today. Many of you probably look at our website and Facebook page. We will add you. If you're 65 and older, we'll get you on the list, and then we will be contacting people on that list once we get vaccine and we can get to that group. Another thing we're doing is we're going to put out a weekly vaccine update. It might be just a few bullet points, but we got to keep it out there so that we're upfront with the public, so they know where we're at in terms of doses, what we're getting, what's happening. It'll be similar to our weekly numbers update that we do on Wednesdays, and I'm thinking right now we're probably going to put it out on Mondays because we usually receive our shipment of vaccine on Monday. So I guess we could probably open it up for some questions, but just so you know, we are working closely with Memorial. We've had multiple meetings with them. We're trying to tackle this as best we can and prioritize. And we have a very good infrastructure. We have a great capacity to give the vaccines. We've run some pretty large clinics, and we're I don't want to say we're a well-oiled machine, but we can really get going once we get vaccines. So, and one more thing. Johnson & Johnson, AstraZeneca, the vaccine is going to be getting approvals here possibly by the end of February, and that could put more supply into the pipeline in early March. So that will really help. But for right now, it's just Moderna and Pfizer, and I will turn it back over to Justin, and then any questions.
Great. Thank you, Larry. Great update from both of you. I want to thank Memorial Healthcare and the County Health Department for all you're doing. Obviously, the barrier right now is simply getting access to the vaccines. Does anyone, I have Gary Jones that's going to jump on here. And obviously, Gary helping, from the governor's office get vaccines is our top priority. But does anyone have any questions for Tom or Larry? I'm going to open it up right now. Anyone have any vaccine questions or other COVID-related questions? If you do, hit *6 on your phone. Go ahead.
I have a question.
Yes,
I have a question, Justin.
Go ahead.
Okay, my question is either for Larry or Tom. If you are already on Memorial Healthcare's pending list, that is, if you're someone who had an opportunity to get a vaccine but had to pass on it for scheduling, and now you're in this queue, so to speak, do you still have to go back and register again on this new link that Memorial started today?
I don't know that answer off the top of my head. I will find out though, and I will get that back to Justin to distribute.
Thank you.
Thank you, Tom. Good question. Any other questions? Hit *6 on your phone, please.
Yes, good morning, Justin.
Good morning. Go ahead.
Shelly Akanicki here. I'm Director of Homeless Angels Shelter here in Shiawassee County. First and foremost, I would like to put a shout out to Mr. Kurtz, Memorial Healthcare's team, Vicki McKay, Megan Smith, and Kelly Jackson for helping us facilitate the first round of vaccines as a 1B here for the shelter for our homeless population. And our frontline workers, our volunteers, which we are so desperately needing back. We operate 14 hours a day at our front desk with volunteers, and it's been really a struggle. So many of our volunteers are from the retirement population, and they've been excited to be able to get started and get back to helping us here hopefully soon after they get their second vaccine. So thank you, Mr. Kurtz and Memorial Healthcare and your team. Mr. Johnson, I'm also on the West Public Schools Board of Education. I want to thank the health department for diligently working hard, countless hours put in and weekends and nights, and being able to create a great event at our schools for our staff, and it went without a flaw. So Mr. Johnson and your team, thank you for all that you are doing. It does not go unnoticed. Mr. Jones, I'm just sad to see that we're not getting the vaccines that our community needs. I heard that we have a lot more vaccines out there that just have not been released, possibly maybe even sitting in warehouses. And I hope that that is not true, but if it is, we need to get these vaccines out as soon as possible. Our community needs them. And if we can be that voice and try to help in any manner, obviously, I know Mr. Johnson and Mr. Kurtz are here to help facilitate in any manner. So thank you guys again and your teams for all that you are doing.
Thank you, Shelley. And Gary, I'm going to give you an opportunity to respond, but I'd like to just keep on the floor here. Any other questions for Tom and Larry right now? Anyone have any questions? Tom and Larry, go ahead.
Justin?
Yes, hello.
Can you hear me, Justin?
Oh, we got a few, one at a time. Troy, why don't you go? I heard you.
Okay. This is for, both of them. If you received the survey through the health department and completed it, should you then, when Memorial opens up, one of these things like they did this morning, fill that out also? Or, I don't want to feel like you don't want to be on multiple lists here, but it kind of almost sounds sometimes like it's a free-for-all, which one's going to get going first. I guess, can you touch on that, which we're supposed to do?
Troy, I'll take that real quick, and then maybe Tom can add in. Get on any list you can get on right now, and we're even saying that on our website. If you get in at Memorial, that's great. We want you to do that because that means you might be able to get it earlier. But get on any list that you can, and I've heard that Myers is taking a list too, although they don't have any vaccine yet. But just get on more lists because we can work that out later with you. Because when we're going down our list calling you or your business or whoever, you're going to say, oh, no, I got this 6 weeks ago at Memorial. And we'll say, thank you. So just take any opportunity you can get and get on the list.
Yeah, I would echo that, Larry. Get on as many lists as you can. Just because of the unpredictability of vaccine delivery. You know, for example, last week we got 1,000 doses. We requested 3,000, we got 1,000, and we were able to deliver all of those last week. Another organization might get 1,000 this week. So just because of the uncertainty of that delivery, I would say to get on as many of those lists as possible. And if you get a phone call, the worst thing that can happen is say, move on to the next one. I got mine at other location. And so I would echo that same comment.
Thank you, Troy. I heard a couple of other people try to jump in there. Go ahead with your question.
Yes. Hello, this is Greg Klasko, Shiawassee Regional Chamber of Commerce. And just a quick question, Larry. I appreciate your and Tom, Memorial Healthcare, and the health department's hard work on this, and just want to echo, the comments. Anything that we can do to, accelerate, vaccines being distributed to our community, we certainly want to be part of. My question was concerning the survey, Larry, that we had sent out to our members, and I just wondered if you could share any of the results as far as that vaccination survey that we sent out a couple weeks ago.
Yeah, sure. I don't have the exact numbers in front of me because Jody, our emergency coordinator, handles that, but we had a very high response rate. And I want to say we probably had over 300 surveys completed for businesses and organizations. And I can't give you the percentage of their employees because I don't have the numbers in front of me, but it was a real high response rate. And I'm heartened by the demand for the vaccine and the response rate. I just wish we had more product, but it was very successful. Thanks for helping us, and we appreciate working through you and Justin on this.
Okay, thank you for that update. I was just kind of wondering how the results were going on that, and that's what I had thought, but I just didn't know if you had any updated data on that, so I appreciate that.
Yeah, Greg, I can say this, and most of you know, I've sent out a lot of notes, a lot of surveys over the years. I've been doing this almost 19 years, and I have never seen a survey get that kind of response. Now, obviously, given what's happening in the world, it makes all the sense in the world. But to your point, Larry, that is very heartening to see that. And it is the number one question I am getting right now from businesses is access to the vaccine. I think we all know we've got to get this going if we are really going to turn our world and our economy around. We've got to get vaccinations going. So this is absolutely top priority. So any other comments or questions for Larry or Tom?
Yes, this is Beth Andrus down in Morris, and I have a question on this group 1B. We were talking about the survey and so forth. Do we know approximately how many people over the age of 65 and how many people in law enforcement and fire department and all that still need to be vaccinated in our county, so that my business, which is in the group 1B, which is further down the list, I guess, so I have some idea when they might be eligible?
I can start real quick on that. The majority of police and fire that wanted the vaccine have received it. So we're good with that group. There's a few stragglers that we're still getting to. The 65 and up, for the most part, hasn't really been started yet, and that is going to take time because that's our biggest group and obviously our highest one of our higher risk groups because of the age and underlying conditions. I will share a document with Justin too to share out with all of you, which kind of clearly kind of defines these priority groups, so that you kind of spells it out for you. I wish I could deliver you better news that we're going to be getting to you soon, but without vaccine, it's going to take time.
Do we know how many over 65s in the county?
What was that?
How many people are over 65 that live in the county? Sorry about that.
Oh, God, offhand, I don't know that right now. There'll be Justin or someone there might have more census data, but we do have an older population, and I know right now I have over at least 3,000 on my list, which are 65 and older.
Mm-hmm. Okay. Thank you.
Thank you, Beth. And yeah, I don't know the exact number, but it's got to be 10 to 20,000 people, I would imagine, Larry. I mean, does that sound maybe in the ballpark, I would think?
Yeah, at least. I'll know better when I find out what this formula is that the state has developed and how it's being allotted.
Yep. Other questions or comments for Tom or Larry? Okay, well, actually, that's a good segue. Gary Jones, Governor Whitmer's office. No pressure, but we need more vaccines here. What's happening with vaccine distribution from the state level?
Yeah, so the state is dependent actually upon the feds, for the vaccine. So, a few weeks ago, one of the things that we did was we wrote to the Department of Health and Human Services Secretary, Alex Azar, in regards to, there was a report that was published in regards to some vaccines that was being withheld. And it actually just was not the governor of Michigan. It was like 7 or 8 other governors all throughout the country, led by the governor of Michigan, wrote this letter. And we got actually a response, and the request was actually approved probably about like a day or so later after it was approved. They pulled the Charlie Brown football on us. I can't think of a better way to describe it, and basically said, okay, actually what we were going to request and what we said that we have that was basically in storage, we don't have it. And so that kind of set us back, obviously, and not just us, but, it's the same issue that's happening all over the nation. All of us, all of the governors of each 50 states, is dependent upon the federal supply. So we tried to get creative and actually try to do a direct purchase from Pfizer. Pfizer, of course, being a Michigan company, but we also had to get permission from the feds in order to do that direct purchase. We wanted to do a one-time purchase of 100,000 vaccine doses. And again, that was under the former administration. And so, it for all intents and purposes, sort of, left. That request essentially left, when the former administration left. So, of course, now under the new administration in the White House, there appears to be more of a focus on, vaccine development and getting it ramped up and getting it sent out. So we're a little bit more optimistic, now. But, again, we are, just encouraging, like our local health departments who have been doing an outstanding job. They take this similarly to the state as far as the approach. Once the state gets the vaccines basically in, we just get it down to the local communities. And then the local communities have been doing such a great job as far as getting shots in arms and organizing for people to get shots in arms that, they're ready for more. But then also the state is too, as well. So we're going to keep our eye on that. And we also got this a coalition, of governors that's actually a part of my official report that I'll get into here in a minute. That's also been helping to elevate, those requests, because again, it's something all throughout the entire, 50 states, in the country, that's an issue as far as vaccine supply. So my official comment, total confirmed cases now statewide of COVID-19 are 551,080. Total COVID-19 related deaths are 14,326. And I've added this new category because I've been getting several questions about vaccines, but number of COVID vaccine doses administered are now 730,453. There was recently a comment that was made on the call in regards to last week's announcement about the plan to reopen indoor dining. MDHHS released this next epidemic order, which will continue the department's fact-based approach to reopening activities and goes into effect on Monday, February 1st. The order will allow for indoor dining at restaurants with certain requirements, concessions at casinos, movie theaters, and stadiums, personal services requiring mask removal, and non-residential gatherings of up to 10 people for 2 households. Through a $39 million in grant from the Going Pro Talent Fund, Michigan is helping nearly 30,000 workers across the state to secure employment, industry recognized credentials, and strong wages by providing training grants to more than 850 Michigan businesses, including some in Shiawassee County, to support their high demand, high skilled talent needs. Also recently, the governors and lieutenant governors from Michigan, Illinois, Indiana, Kentucky, Minnesota, Ohio, and Wisconsin joined together in a video to encourage everyone to make a plan for how they can get the safe and effective vaccine once they become eligible. Over the past 10 months, people from across the region have stepped up to fight COVID-19. States across the region are working around the clock to ramp up vaccine distribution efforts and end the pandemic once and for all. Recently, these governors came together to urge individuals to make a plan for themselves and their families on how they can get vaccinated as soon as possible. People are encouraged to visit their state health department's website for more information. And recently, the governor announced the Michigan COVID Recovery Plan to grow Michigan's economy in the COVID-19 pandemic. The plan includes a strong focus on the following areas: vaccine distribution, support for small businesses, good jobs for Michigan, unemployment benefits, food assistance, rental assistance, the Office of Rural Development, property tax assistance, talent development, Reconnect / the Futures for Frontliners wraparound supports, and schools. Also, there are slides that are available from the State Budget Director, David Masseron's presentation recently given on the governor's COVID recovery plan. So for anyone who would like more information about the plan, I can get that sent out to you. And lastly, the governor will deliver her third State of the State address tomorrow at 7 o'clock, Wednesday, January 27th. And due to the ongoing COVID-19 pandemic, the State of the State address will be held virtually in compliance with CDC in the state of Michigan's best practices. And just like to plug a couple of good website resources, and then we can open up for questions. Michigan.gov/COVID vaccine is the best catch-all website in the state in regards to any questions that people may have regarding the vaccine. And Michigan.gov/coronavirus pertains to all things related to coronavirus or COVID-19 in the state.
Gary, thank you. As always, appreciate having this pipeline of information, not only on our calls, but as many of you know, we share your updates via email as well and social media. So I'm going to open it up again. I do have a few non-healthcare vaccine related updates, but I want to open up the floor one more time. Any comments or questions for Larry, Tom, or Gary? Anybody have anything? Hit *6 on your phone, please.
Yeah, Justin, this is Tom Kurtz. I have a question for Gary.
Sure.
Yeah, Gary, I've read a lot in the last few days about President Biden's plan for 100 million doses in his first 100 days of office, and I've also read about Governor Whitmer's goal of seeing 50,000 doses a day being delivered. From the governor's office, when does the administration feel that we can get to that 50,000 doses a day being delivered? I have heard from many of our partner healthcare facilities, our own facility, we can significantly ramp up administration of those doses as long as we have them. So when do we feel that supply chain might be robust enough to handle that 50,000 dose a day goal?
Yeah, so I don't have like a calendar, date to be able to give you on the call. As soon as we have that information, we'll definitely be, working with, of course, all the healthcare, health departments, the hospitals, as far as getting that date. But just kind of a general answer, everything is dependent upon the supply that's available. So, and again, not just the state of Michigan, right, but, all of the governors in every single state, in the country, as soon as supply, gets ramped up, to that level, then, that's the goal that we would like to set, is actually 50,000 shots in arm a day. So there'll be more information that'll be forthcoming, down the line.
Hello,
Yeah, go ahead.
I have a question. Shelley Akinicki here again. Mr. Jones, last week you gave us a number of 487,059 vaccines that were sent out. I asked you how many vaccines the state had received at that point. You referred me to a website, and I was unable to find that. Do you know to date how many vaccines have been brought into our state? And you stated today that there are 730,453 vaccines given this past week total. That's another 243,400 vaccines from last week. And where did those vaccines go to specifically?
Yep. So probably better to do it offline. That way I can, sort of help navigate the website. But the michigan.gov/COVID vaccine, on that site, there's actually a dashboard. It says access, to the state data. A lot of great information is on that site. But if you couldn't find certain areas on there, and when I say a lot of great information, I know it may be difficult to, perhaps navigate it. But I can get you my contact information, and then I can make sure I'm, pointing you in the right direction to get those questions answered. Also, the amount that I said at the top of the call is the number of COVID vaccine doses administered total. So that's based upon the amount that has been sent to the state, and then the amount that is actually administered in the state. So it's the total number, not the number based on the prior week.
Right, and I stated that was just over 240,000. I just wondered where those vaccines went last week.
Yep, it's on that website. Like I said, we can hop offline, and then I can, kind of show you a little bit more in the dashboard where to find that data.
Okay, and then I wanted to follow up a second question I had with you last week. You had referred when I said that we were struggling with our poorest population having their bridge cards shut off. I wanted to let you know that I followed up with the local DHHS worker that I typically work with often, and asked her how that is working for her and how that is going. I spoke to her this morning, and she said that is not helping us at this point. So I was kind of just wanted to ask, can we just have the bridge cards not be shut off as we are for Medicaid currently? I realize I'm asking something that I'm not aware of how that specifically works in our system, but currently, Medicaid is not allowed to be shut off in a pandemic. Can we do the same for bridge cards?
Yep, let's take that question offline too as well. That's going to require me to tap some of my colleagues to get their feedback on that. So a couple of things we can follow up on.
Okay, I will be getting with you.
All right. Thank you, Gary. Thank you, Shelley. Any other questions for Tom, Larry, or Gary? Anybody? Hit *6 on your phone. Anybody else? Last call. Okay, wow, that was a very robust update in Q&A. Thank you, Larry. Thank you, Tom. Thank you, Gary, for the update and all that you do. This is obviously top of mind for our stakeholders here. So please consider this an open invitation every Tuesday morning at 9 a.m. If any or all of you want to jump on and give an update, I know it would be much appreciated by our stakeholders. So thank you all for what you've done today and all you're doing to help keep us safe now and going forward. We're running a little behind on time, so I'm going to make my update very, very brief. The biggest thing I want everybody to know is the grant window for the Michigan Small Business Survival Program. That application window has closed. We ended up with somewhere, I can't remember the exact number, but it's between 100 and 110 applications in Shiawassee County for that funding. We will have 31 grants to award. So just want to put that in perspective. So we have a little over 100, 31 grants to award. They will be $15,000 a piece. Our organization, SEDP, is working on reviewing those grants. We're actually going to be meeting later this week to go through those. And then hopefully we can move that forward and get awardees notified and money processed as soon as possible. So there is a scoring system that came with it. So that will help with the process and speeding it up. But I want to let you know we are on top of this. I know some people on the call have applied. We are going to give everybody obviously due process here. And I just wish we had more money, but we're very grateful for the money we have received from the state, and we'll make sure that we can help out 31 organizations in Shiawassee County with those dollars. The other grant program that's out there that is more of a targeted program that's only applicable to a few businesses in Shiawassee, but I do want to announce it, is the SOS, or Saving Our Stages. So this is meant more for the entertainment venues that are out there, the live venues. So we do have a few folks that do fit in that category. That application is open, I believe, until Thursday. So if you are in that, or if you know of somebody in that, we would be happy to talk to you more about that. And then the last thing I want to note, we do have several events coming up that you should have received emails on. If you haven't, we will send out a reminder. We are doing a stakeholder coffee update this Thursday morning. This is not so much about the update calls we do here. This is more of an economic update, what's going on with our organization, with the local economy. That's going to be 8 o'clock on Thursday morning. And then next week, a lot of stuff going on. Tuesday at 11, there's going to be a webinar with USDA Rural Development. That's federal. They have grants and low-interest loan programs for business, government, nonprofit projects. So we're going to introduce you to their programs. Wednesday at 11, the 3rd, there's an event on PACE financing. That is a tool to help with energy efficiency improvements. If you're looking to do something with your building, as far as heating, cooling, windows, roofs, things like that, lighting, you're going to want to attend that. And then finally, on Thursday, there's actually going to be an event hosted by Covenant Eyes. You've seen this before, the business model canvas. That's going to be at noon. Greg, I know you're a partner on this. Greg Klapko from the Chamber. Do you want to mention anything on that event on Thursday?
Yeah.
Oh. Are you there, Greg? There you go. We can hear you. You there?
Okay. Yeah. Can you hear me okay?
Yeah, you're good. You're good. Go ahead.
Okay. Yeah, I just wanted to mention this event. We've got a large room in the basement here at the Armory. So we want this is going to be a virtual event, but it's also an in-person option for anyone that would like to attend. We've got a room downstairs that we can socially distance and mask up for those folks that would like to, attend here in person at the Armory. Just please let us know, because obviously we're limiting the number of people to attend in person. But we're looking forward to the event. It's kind of the first time that we've promoted it to our chamber members, and we thank our partners at Covenant Eyes and Brian Delorge to putting on this business model canvas. And we look forward to seeing some of you folks, and whether it be in person or virtually.
Great. Thank you, Greg. And with that, that's all we had for the agenda today. As always, if anything comes up, let us know. We will absolutely stay in touch. I already emailed out information from Memorial as well as the health department. We're going to keep that flow going. So check your email. We'll stay in touch with you. And as I said, if anything comes up, let us know. So that's it for today. Thank you, everybody. We will talk to you again next Tuesday.